Hello and welcome to another video with the Practice Nurse Mentor. So today I thought I would just do a really quick little video about what general practice nursing actually is. There's probably a lot of gaps in the knowledge, I guess, in the community about what we do here, and I certainly amongst other nurses in other fields and in the hospitals and stuff like that, they don't really have an understanding about what kind of work we do. I think we've got a little bit of a lush job when we really don't. And I think too, if you're thinking about coming over into general practice nursing and you're wondering whether or not this is the kind of thing that might be right for you, then this might be a really helpful video for you, because I'm just going to go through really quickly the kinds of things that we do as a general practice nurse. So general practice nursing is basically part of that whole primary healthcare nursing. So primary healthcare is that first service that people come to for their health outside of a hospital setting. So that would include coming to the GP. It also includes allied health services, going to a physio, a dietitian, all that kind of stuff. It also includes your pharmacies, because you can attend to them and speak to a pharmacist and get healthcare advice and medications and stuff. And it also includes community nursing and maternal and child nursing and things like that. So most things outside of that hospital or aged care setting pretty much falls into that primary healthcare framework. So general practice nursing, I think, is a really dynamic and specialty field. You'll find that even amongst different practices, there'll be slight variations in the kinds of jobs that we do while we're here, and that will be based very much on the kind of work, the kind of demographics that are being that are at that practice, and the kinds of skill levels and number of doctors and number of nurses and all of those kinds of things. So there is a bit of variation there, but we are at the forefront of primary healthcare. We do so much in terms of trying to keep people healthy, well, managed and out of hospitals as much as we possibly can. So the other thing is it's a really diverse thing. So we see people across all ages and stages of life. So we have newborn babies right through to palliation, end of life care, managing of everything in the middle. So it's a really broad spectrum that you'll work with. There's rural and remote, as well as those urban and metropolitan areas. So, you know, there's a lot of diversity depending on where you're going to be working. We deal with the acute stuff, subacute, as well as chronic care. So again, lots of variety, a broad spectrum of the kinds of work that we do. Chronic disease management is a really big thing, because chronic disease in itself is a really big thing. So that is a significant aspect of what we do in primary healthcare and in general practice. But we also do balance that out with preventative healthcare measures as well. So when we're looking at immunising and giving patients education and doing health screens and all of that kind of stuff and monitoring, we're kind of trying to balance out the prevention rather than, you get to the point where you've got a health concern or a chronic problem that now we have to manage it and treat it. So there is a big focus on prevention as well, and I personally really love that part of it. And I guess it goes without saying, but I'm going to say it, that we do provide a hell of a lot of support and that compassionate, holistic care that we do. A lot of people will come to their GP for reassurance and information and understanding about things. And so, we tend to, if you're someone that needs to see their GP a lot, then, you're going to build that rapport, you're going to have that therapeutic relationship with them, that that you can discuss things with them, that you trust them. And so, there's a lot of human kindness that is fostered and developed when we work very closely with people over and over and over again. So all of those things are pretty much what I love about nursing, and it all aligns with my values about nursing and caring for people and all that sort of stuff. So that's why I'm passionate believer in what I do. As for the kinds of things that we do in general practice, if you're thinking about being a general practice nurse or just wondering what the hell it is that we do, so I'll just go through, I suppose, a bit of a list of any kinds of things that I might have in my day. So administering medications is probably a really big one, and that could be injections. We do a lot of injections, especially intramuscular injections, but we do a lot of subcutaneous stuff, and that could be just for managing the chronic conditions, mental health, vitamins, or antibiotics if someone's acutely unwell. We do infusions, so we can do iron infusions, and different practices will do other different things. Wound care is another big one, and that might be just acute, someone's fallen over and hurt themselves, or the dog bit them, something like that. Subacute, something that's been there for a couple of weeks, they had a fall, got a skin tear, we're managing that, takes a few weeks to get better, right through to chronic disease, chronic wounds and complex wounds, ulcers, vascular disease, all of those kinds of things. So we do a fair bit of wound care in there as well. We do a lot of what we call point of care testing, so beyond just your basics of doing blood pressures and height and weight and things like that, but things like checking blood sugars, checking urine, ECG, spirometry. Some practices will have ABIs and the ambulatory blood pressure machines, and we do a Holter monitor here where I am, so we do that. INR, so checking coagulations. Some practices also do like pre-employment medicals and drug and alcohol screenings, audiometry, those sorts of things. So there's a whole range of different skills and tasks that we do. As I said before, the chronic disease management stuff, so care planning is a huge one, a very, very big proportion of what we do, and that's liaising with allied health providers and making sure that they're having regular monitoring, and that we're meeting the minimum standards of care, not just the minimum, but we're optimizing the standard of care that we're doing for the management of that chronic condition, and making sure they're seeing specialists and stuff like that. Health assessments is another big thing that we do, and that's various ages and groups of people that we do health assessments for, and there tend to be either a very specific thing that we're looking at, so heart checks or diabetic checks and things like that, people with disabilities, but also the older population, so over 75s and things like that. So there's different age groups that we can do health checks and health assessments for, and some of that's that preventative stuff, and the rest of it's the holistic stuff as well. So patient education, so you might get someone coming in, they're about to start a medication, or they've just been diagnosed with diabetes, and so you've got to go through a whole range of information and get them set up with things and hooked into services and resources and supports and stuff like that. We do procedures, so some places will do biopsies of the skin. We can do like earwax removal, contraception devices, whether it's implants and IUDs and things like that. We might have acute injury presentations that we manage on the day. Someone needs to be stitched up, or they've got something in their ear or something in their eye, whatever. Taking sutures out if they've had operations elsewhere, taking staples out post-operatively. So yeah, we do a fair bit of procedural work. Triage is another thing too. We'll get people ringing up saying, they've had a fall, or their child's come off the monkey bars and hit their head. Someone's sustained an injury at home or at work or something like that. Someone's feeling unwell. Do they need to go to the hospital? Someone's having chest pains, can't breathe properly, blah, blah, blah. So sometimes they'll ring us up and have a talk to us and see whether or not they can come here and see us for those sorts of things, or whether they must go to the hospital. So we do a fair bit of triaging and figuring out what people need. And then there's like the non-clinical side of things as well. So we don't always, it's not always just about working with people, patients, but You know, nurses tend to also be the ones responsible for ordering the stock for the treatment room. We're the ones that tend to be involved pretty heavily with things like infection control policies and procedures, cold chain management of our vaccine fridges, and stuff like that. We do a lot of follow-up on patients and recalls and reminders, results and all that sort of thing. Quality improvement is another huge one. So we're usually involved pretty heavily with that kind of thing, and that's things that we are responsible for reporting back to the health departments on. So that's a necessary requirement every quarter for us to be doing here. And so, yeah, some of it is not clinical side of things, but there's a very large amount of work that we do and that we assist the GPs with, or we assist our practice with. And so, yeah, it's a busy job, and usually we are overworked and underpaid, but that's another story. So yeah, I hope that's been helpful. I'll end it here. I'll just keep it short today. Just thought I'd give you a bit of a brief introduction. If you have any questions, pop them in the comments below. And if you have any ideas or suggestions about videos that you'd like to hear from me, please do so. And yeah, if this is the kind of content that you're interested in, please feel free to subscribe and keep an eye out for some further videos down the track. Thanks guys, have a fabulous day.